Hey everybody, this is Andrew Peterson. I'm your host of the Palm Beach Cosmetic Surgery podcast, and I'm here today with Dr. Michael Sistare, Palm Beach County's newest cosmetic surgeon. Very eager to get started on some patients here versus where he was before. We're also here today with Savannah, who has actually undergone a breast augmentation, and therefore, the topic today is breast augmentation.
That's right.
A somewhat controversial procedure, but not really, right? We're here to help people achieve their aesthetic goals, and that's what we do.
Yeah.
So, Dr. Sistare, why don't you take it away?
Sure. Yeah, it brings up a great opportunity
What
to
is
discuss.
breast augmentation?
Yep.
Real quick.
So, in general, a breast augmentation, if you're looking for the biggest scope of the definition, it's undergoing a procedure to change the volume of the breast. Most often that's accomplished by placing an implant either above or below the muscle, and this implant is normally composed of either silicone or saline, and it does just that. It increases the main aspect of it is it increases the volume of the breast. To a lesser extent, it increases the shape, changes the shape of the breast. But there's a few different breast procedures to address all different aspects of the breast. But by and far, breast augmentation is the most common cosmetics procedure accomplished in the country, and for a good reason. People get really good results with the implants that we use nowadays, and it's just a desirable outcome. A lot of girls, a lot of guys want to be So
I know I did.
So when you say that there are different breast procedures, I mean, I know about, like, obviously there's breast augmentation, which you say increases the volume. The breast lift is different from that, or is that done at the same time?
It can be done at the same time. More often than not, if someone undergoes a breast lift, the vast majority of times, either at the same time or later on down the road, they eventually increase their size through an augmentation procedure. That can be accomplished together, but not necessarily. There's four major categories of breast procedures. There's breast augmentation, there's breast lift, otherwise called a mastopexy. There's breast reduction, which is taking off the excess tissue that contribute to a bit of the comorbidities associated with having larger breasts, specifically its back pain. And then there's a fourth category of breast called breast revision surgery, someone who's undergone one of the three procedures previously mentioned, and then they come back wanting some aspect of the shape or size of their breast changed. So 3+1. The reason we decided to have Savannah on the show is because she's in a unique position of being someone who's undergone an augmentation procedure, and now you have the opportunity to tell us some questions that you wish you had asked beforehand, some questions that you kind of wish you had known the answer to, considering your post-operative course. So I'm happy to have you on. I didn't do your procedure.
No, you didn't.
But you underwent the procedure with a surgeon colleague of mine while I was undergoing my fellowship training. So I was right there with you.
You were right there.
So, and you're also my girlfriend. So I really, there's a conflict of interest there. So at that time, I felt more comfortable with you going the route of getting the procedure done by somebody else.
And you played an excellent nurse too.
I did. I tried my best. So,
well, I just have one question. Are you happy with the results?
Overall,
of the breast augmentation?
Overall, I definitely am. I mean, I went from having nothing. I mean, I'm tall, I'm 5'9", and I work out, so like I'm athletic, and with lower body fat, you tend to have smaller boobs. And, it was something that, like, I had always wanted. My mom has a breast augmentation. I remember being younger, too, and wondering, when are my boobs going to come in? And she said, when you pay for them. So I was very happy. I was...
so your family supported you in
100%,
your journey.
100%,
yeah. You could say.
Yeah, my aunt was a Hooters girl, too. Hooters bought her boobs. So,
wow.
Yeah, you could say it's a family tradition.
Wow,
sure.
But... yeah, there is, I feel like, a lot of things, that when you're going through it, you just kind of find out in the moment. And then, like you said, you think about, oh, I should have asked this, I should have asked that. So, for example, like determining the size, that was definitely an interesting experience. And, I did all this research and I was thinking, I saw that the average size was, somewhere around 325, 350?
In that range.
And how big are mine?
Yours are 540.
Which sounds like a lot.
The 540 is that what is that?
CCs.
Cubic centimeter? Okay.
CCs or milliliters.
Yeah, which sounded like a lot, and I was really hesitant to go that big. But like determining that, like trying everything on, made me feel a little more comfortable. And you have said that you hear a lot of people come back and say that they wish they had gone bigger.
The number one complaint following breast augmentation is the fact that I wish I had gone bigger.
Mm-hmm.
That's what you hear.
Yeah.
So you read online that, like you said, about 300, 350 in that range is the average, and that's probably true the majority of the time, but there's so much tailoring that goes on when it comes to picking the individual implant for the individual person. Like you're a bit of an outlier in that you're tall and that you work out a lot, so you had a relatively low body fat percentage. You have this broad chest of someone who lifts weights, and a 325 cc, 350 implant cc implant probably is definitely not going to look the same as a 350 cc implant on someone who's say 5'5" and of normal athletic build. So
how do you normally determine the size for people?
A lot of experience. There are some particular measurements that you can undergo. So there's a few different implants. Not all implants are the same shape, but just different sizes. So my main implant supplier is Mentor. The other main implant supplier on the market is Allergan. They have the same kind of options in that both come with three major options when it comes to picking the right implant. The differences in these implants are its width compared to its height. So the wider the implant is, the shorter, the lower profile it has, and then the more narrow the implant is, the higher profile it has.
So it's more complicated than saying, I want to be a D cup.
There's more from the patient's perspective. That's really all they need to tell me. But from the surgeon's perspective, there's a few more choices that go into picking the final implant.
Okay.
I know there's different ways that the implants. There's above the muscle, under the muscle. Can you tell us a little bit about that, and then maybe you can, if you don't mind, tell us which option you choose.
So there's three major places to put the implant. So if you think of the anatomy of the chest wall, there's skin, there's a little bit of fat, and then sitting on top of your pectoralis muscle, if you're a girl more than a guy, you have glandular tissue that makes up the breast that isn't fat but kind of feels like fat. Underneath that is the pectoralis major muscle. Underneath that is a strip of muscle called your pectoralis minor, and then below that is your chest wall. We hit ribs and the muscles that lie between the ribs. So there's three areas that you normally put them. So subglandular is beneath the gland tissue of your breast, but on top of the pectoralis major. There's something called subfascial, where the outer covering of the pectoralis major is lifted, and you place the implant directly on top of the muscle fibers, but underneath the covering. It gives you a little bit more durability in the placement of the implant. And then by and far the most common place to put the implant is directly underneath the muscle. One, it gives you a natural look. Two, there's some evidence that it decreases the rate of scar tissue formation following the implant, which can, if left unchecked, can eventually distort the shape of the breast. And it's pretty easy. Compared to the other two, there's not a whole lot of benefit in the subglandular or subfascial position, but there is multiple reasons to pick the submuscular position.
And that's what I got.
You got a submuscular implant.
Yes.
Right.
So it sounds like it's more complicated than just above or below the muscle. There's like two that can go above the muscle, and then one is the below the muscle.
Right.
Okay.
Right.
But it's like varying degrees of layers.
Right. So, for example, like I said, you had a 540cc implant. You would probably not be able to fit a 540cc implant under the chest muscle of someone who's, say, 5'2", 5'3", or narrow-framed. There's simply not enough room.
Right.
If you want a really, really big implant, say 800 cc's, below the muscle is just not an option. You have to place it above the muscle because the skin has a whole lot more laxity than the muscle itself.
Okay.
It's just something to keep in mind. So it comes down to the individual choices of what the girl is telling me that she wants. So
that would influence then the decision to go above or below.
It's one of the factors
is implant size, body frame. Anything else?
Shape of the chest wall. Sometimes people have this big round rib cage. In which case you probably want to pick the wider implant versus the higher implant because you just want the implant to sit across the entire side of the chest
rather than kind of just sitting in the middle, like that bolted on look.
Right.
Almost.
Yeah, exactly. So there's a few different criteria that go into picking the right implant for the right girl.
So it really is an art.
Yeah,
Yeah.
you might say that.
Yeah,
Yeah,
that's
exactly.
There's a lot going on in there.
You know, all cosmetic stuff is part art, part science, right?
That's one of the reasons why I got into it.
Yeah.
It's not just seeing a problem and fixing it. There's a whole lot more that goes into that.
So, Savannah, you had basically, when we spoke earlier, you said there were some things that you didn't ask when you were going through the procedure. And,
Yeah.
And, you know, you're very happy with your results. Can you tell us a little bit about
Yeah.
post-surgically? What questions or things that you might have questioned after?
Yeah, so I would say I guess I had naturally just assumed that when I, got my boobs done that it would create like a natural cleavage. Well, my natural breastplate, I didn't have natural cleavage, not only because they were small, but because, you had said I have like a wider frame, and so they were far apart naturally. It makes sense that when they are augmented, they would then sit far apart. And I was kind of waiting, and I didn't really know that the natural cleavage, or quote unquote natural cleavage, wouldn't just kind of come together when they dropped. Can you talk about a little bit of how you would fix that?
So yeah, so there's two different strategies when it comes to placing the implant in the right position, and this is why it's important to have a full conversation with your surgeon to make sure everybody's on the same page. So ideally, what you want to do is you want to place the implant directly underneath the nipple, where the nipple is sitting in the middle of the implant. A lot of people's nipples come in all different positions. Some people's nipples are really far apart, some are really close together. But in general, a good rule of thumb to give the best aesthetic outcome is to place the implant directly with the nipple centered on the implant. However, if you're the type of person whose nipples are already wider on your chest, but you want a more narrow position, a breast augmentation doesn't change the position of the nipples, it just adds volume to your breast.
Right.
So if you are okay with your nipples sitting a little bit wider on the mound of your breast, then you need to have a conversation with your surgeon so that they place the implant more narrowly on your chest wall.
Yeah.
In fact, that's one of the limitations of a under the muscle implant is so the chest, the pectoralis major muscle connects from the top of your humerus, your arm, to the side of your sternum. That's why it gives you this motion. When placing the implant underneath the muscle, you place the implant as medial as you can on the chest wall, but you're limited by the attachment of the muscle onto your sternum. So some people have a little bit wider connection of the muscle to their sternum, so they're left with a flat spot where their breastbone is. One way to get around that is to place it above the muscle. You can technically go as close as you would like. You can technically make it one long cavity, but that's not. It's called symastia. That's not a desirable thing. You can get that really close together, really natural cleavage, and leave the implants really high on the chest. But it takes a little bit more surgical expertise. And it's a conversation, like I said, it's a goal that you need to know that your surgeon is looking to achieve, in order to give you satisfaction from your procedure.
Right.
How to fix it? If it's something that you really don't like and you really want to go through the process of getting more surgery to fix it, it's pretty straightforward. What you do is you remove the implant that you already have. You put it on the back table. You put it in an antibiotic solution so it doesn't get dry. And then the cavity, the open area that your implant used to lie in, all you do is you suture down the lateral aspect out here, and then you open up the medial aspect of it. So it basically shifts the whole implant inward. And you take the same implant, put it back in. I mean, easier said than done, but it's still surgery, but it's a fairly straightforward fix because it's not an uncommon complaint.
Right.
Because when you're lying on your back, no matter who you are, your breasts tend to sag to the side. So that if they're going to sag, they tend to sag down and out. Rarely someone will sag straight down. Most of the time, 80-90% of the time, they go down and out. So it's a fairly common complaint to address, and because of that, we have a fairly well-known algorithm in order to fix it.
Yeah, and I mean, like, besides that, I'm very happy with how everything went. The recovery was really easy. I was up and walking around the next day. I was down a little bit after, the day of.
Why don't we talk about the surgery itself? Let's not get too far ahead of ourselves. The day of the surgery, can you tell us more about your experience of going through the surgery and
Yeah.
after?
Yeah. So I was really, really excited. You don't eat. But I did IV sedation, which I didn't go under. It was in general. I don't know what the medicines were, but it was, what do you call it? Twilight?
Twilight is what
So
I normally call it.
you're knocked out, but not completely under.
You're awake enough where so you're breathing on your own.
Mm-hmm.
You don't need a tube or a machine to breathe
Mm-hmm.
for you. You're awake enough where if we wanted to wake you up and give you direction, you would
Mm-hmm.
follow our direction, but you don't remember anything.
I don't.
From your point of view,
No,
it's all the same.
I don't remember anything. And I mean, I went in, and then I came out, and everyone was like, "Hey, how are you?" I was like, "What?" It was like wisdom teeth surgery, and I just kind of took a nap in PACU, and then we went home, and I ate some soup, and I was really sore. I would say directly underneath, like kind of around the ab rib cage area, which I wasn't expecting. I thought that was odd because I didn't get my abs done. I got my boobs done. But then after sleeping it off the first day, the next day we were up and walking around.
You bounced right back.
Yeah, I went to the farmer's market with my dogs, and it was just.
So in terms of recovery, you were up and active the next day,
pretty
not in
much.
any kind of pain. You didn't have to lay in bed for a while or anything like that.
No, it didn't lay me up. I mean, it was a little difficult to raise my arms a little bit, but that lasted maybe 2 or 3 days. Overall, I think I had a harder time recovering from getting my wisdom teeth taken out.
Wow.
Then, yeah.
You had a pretty easy post-operative course.
Yeah.
Most people tend to complain
lucky.
a little bit more about that. One disadvantage of placing the implant under the muscle is, even though we're not cutting any muscle, we're putting it in an area that exists a normal area, a normal place to place the implant. Because you're stretching the muscle and the muscle is now stretched over an implant, you're pretty tight when you wake up.
Yeah, it did. It felt like it felt like I had done maybe 1,000 push-ups.
Okay.
Yeah. So it was sore, but it wasn't.
Intolerable?
It wasn't intolerable. No, and I mean the, over-the-counter medicine did pretty well with it.
I don't even think that you finished the pain medicine that we set you home with.
So sore but not painful.
Yeah.
Recovery, post the first day, how was it in terms of? I know that from our other work that we've done on videos that basically the breast implants take, the scar tissue has to form around them.
Yep.
And what have you. Can you explain a little bit about that, and then we can see
So,
what her period
yeah.
was like?
Once we place the implant, your body's natural reaction to a foreign substance inside your body is to wall it off with scar tissue. As surgeons, we're reliant on that scar tissue because it forms a nice little pocket in which the implant sits. With no scar tissue, the implant will eventually sag much more quickly than it would if you don't have scar tissue. However, if too much scar tissue develops, it forms this capsule, and that capsule contracts down to the chest wall, and it distorts the shape of the breast. So there's this nice little golden area that most people fall into 95% of the time, where your body creates this nice little pocket of scar tissue, and it allows the implant to sit right underneath your muscle, and it stays there for as long as it does, for many, many, many years. And like I said, we're reliant on that scar tissue to develop. There are some newer implants that are coming out now. So like I mentioned, the drawback to relying on the scar tissue is some people develop a lot of scar tissue, especially implants that have been in for a very long time, 30 or 40 years. And
wait a second here. 30, 40 years, that's a long time to have an implant in, right?
Yeah, well, no. So
tell me more about that.
So it used to be, and this is, it used to be that the manufacturer recommended, they said the life of the implant is 10 years. But
is that like a best used by date, or
it leaves a little bit. It leaves the big question is, well, does that mean I should to replace my implant routinely after 10 years? No. If it's not broken, don't fix it. If you're perfectly happy with with the size of your breast and the shape of your breast and the way your implant looks, there's no reason to go in and remove a perfectly good implant and put in a brand new one for what seems to be no problem. The life of the implant is indefinite, as long as you don't have a problem with it.
But the tissue around it isn't.
So just because you've had an implant in for a long period of time doesn't necessarily mean that scar tissue is slowly going to keep getting thicker and thicker and thicker over the course of your life. It just happens to be that people who have had them in for the longer time tend to develop a bit more scar tissue versus the people who haven't had them in that long. So you don't need to routinely replace your implants unless there's something that you want to change. It amounts to about at 10 years, there's some aspect of the breast that you want changed that warrants further surgery. Either there's ptosis or sagging, and normally that's addressed with a breast lift, and we say, well, since you're going to undergo a breast lift, do you want to change the implants? Do you want to increase the size, decrease the size? It allows us the opportunity to alter some aspect of your breast. So most people undergo some type of change by 10 years, but you don't necessarily have to.
Okay.
And that would be a breast revision procedure?
It would be a revision procedure. It would more technically be just another lift aug. So
but this is something, I mean, basically their implants can last indefinitely.
Yeah.
As long as they're happy with how their breasts still look at whatever period of time after the implants. Right?
Exactly. Yeah, you don't need to routinely replace implants.
So it's not like cars' tires, right?
No.
They're not wearing out and having to be replaced. They don't, like, I'm just saying, like, the material doesn't thin out and become more brittle or anything like that to where you would have to replace it because it might fail.
So that's interesting. So so the material that you're talking about is the shell of the implant.
Mm-hmm.
And
we're specifically talking about silicone, right?
yes.
Okay.
We haven't really drawn on saline too much. The shell of the implant, there are some studies that say it becomes more fragile the longer it stays in your body.
Mm-hmm.
However, the material, the silicone inside of the shell is a very unique material. Mm. If you had a saline implant and the shell ruptured, that saline would leak out. It's essentially water, right?
That happened to my mom.
Yeah?
Yeah.
And she had to get replaced.
Sure did.
Because it's very obvious.
Yeah.
One completely deflates and the other
Did that just happen on its own, or was there something that caused it? Because
Yeah.
I know that car accidents and things can damage implants, correct?
Yeah, I think it kind of just happened on its own. She told me she woke up one day and she was very lopsided, so she had to get it fixed.
And that's not dangerous, right? Or,
no. In fact,
because your body just absorbs the saline. It's
just absorbs the water.
Uncomfortable to have a difference, I guess, right?
Yeah,
Unmatched,
you're not going to feel any pain at all. You're just going to look up, like you said. You're going to wake up one day and go, "Oh, what's going on here?"
Yeah.
But on the inside of a silicone implant, that silicone is a very unique material. They've gone through several different iterations of the silicone implant. The new silicone that they have on the inside of the implant is very cohesive, meaning it sticks to itself. So even if you have a defect in the shell of the implant, the silicone inside, it doesn't leak out. It's not water. It does a really good job of sticking to itself. So I'm not going to rupture these implants I have next to me, but if I took a knife and I cut a hole in the side of the implant and I exposed the silicone, I could sit there and I could completely evert the silicone and try to shake it out of the implant, and then once I place the implant down, it's going to go right back to its normal shape.
And if it was in a capsule, it would just stay within the capsule.
Right, but exposure of the capsule to unprotected saline will probably cause a little bit more scar tissue. So that's the reason I brought that up. The longer the implant stays in your body, technically, the higher chance it has of rupturing. That doesn't necessarily mean it's going to rupture, but the longer it's there, the more likely it has a chance of rupturing.
Yeah.
If it ruptures, and if the scar tissue on the inside of that pocket is exposed to the silicone on the inside of the shell, it will cause more scar tissue to deposit. So that's one of the reasons why the longer the implant is in, the more likely you have a thickened capsule. And that's one of the places that this 10-year recommendation comes from.
I see.
So as long as the implant stays intact, and the vast majority of times it does, as long as the implant stays intact, you don't need to replace it.
Well, that's good to know. Mm-hmm. So they can optionally revise it unless obviously something goes wrong. Now, you talked about saline versus silicone. Or how much are saline implants still used? It seems like there are certain disadvantages to that at this point.
There's advantages and disadvantages. So like I said, if the saline ruptures, it's very obvious that it ruptures. It all leaks out. If you want to know if your implant is ruptured, I mean, saline is a dead giveaway. Mm-hmm. But just because an implant is ruptured doesn't necessarily mean you need to take any action to it, because, like I said, the silicone on the inside, it stays inside the shell, even if it is ruptured.
Mm-hmm.
It's not going to poison you.
No. We've done a lot of studies. It doesn't cause any problems. You can theoretically go bigger with saline. At the upper end of size, saline I've seen 1,000 cc's of saline. As far as I know, manufacturers only make about 800 cc silicone implants. Anything beyond that is really used for tissue stretching and reconstruction following cancer. So if you want really, really big, saline is the way to go. Some people do not like the idea of having a foreign substance in their body. They don't like the idea of being exposed, having the potential to be exposed to the silicone, so they opt towards saline. But the disadvantages, water is incompressible, so when you push on saline, it doesn't mold, it doesn't change, it's kind of hard. This silicone is manufactured in this way because it resembles the natural consistency of breast tissue. So this does a really good job of feeling as natural as possible.
That brings up an interesting question that a lot of people have, which is there how does it feel after, and also there's also another question related to, does it change nipple sensitivity? I see these questions coming up quite a bit.
Sure.
So can you tell us from a standpoint of how did your breasts feel? Obviously they were larger, but is there a difference in terms of sensations and how it feels?
So
at
first, I'm going to be totally honest. At first, I was like, "Oh my God, what did I do?" Because they were hard, and he assured me that they, they're gonna calm down, and they'll eventually, feel the way that they're supposed to. And I would say it took probably about 3 to 4 months for them to actually feel like boobs. And so I mean, it was definitely, I was like, "Oh my gosh, is this ever gonna happen? Like, is this what people talk about when they're like, I don't like fake boobs that you can always tell?" I'm like, "Oh my gosh." But then after about 4 months, they calmed down, and I was like, "Oh, okay. They do feel like boobs. I believe everybody now." Okay.
Yeah.
And then as far as sensitivity goes, I went inframammary. So it went underneath the fold of the boob. So it didn't really affect any sensitivity or anything as far as that's concerned. So that stayed intact.
And that tends to be what I tell people. I try to give them the expectation. They're going to be high. They're going to be hard.
Yeah.
It's not going to feel natural.
Yeah.
Don't think that you've reached your final outcome for at least 3 months.
Yeah.
And you said 3 or 4 months.
Yeah.
That's what I tell people. You got to go in with the right expectation.
Yeah.
After
so what's happening that makes that change happen in terms of the...
it's the process of forming the scar tissue, and it's the swelling as a direct result of surgery. And it just takes time. It
has nothing to do with the implant itself. It's just your body adapting to the implant being there.
The implant is always going to maintain this this consistency.
And what's the size of that implant?
This one right here, we have. This one is a 375.
So Savannah's are bigger.
Yep.
And then is there a bigger one down there?
I think you had the size that I have in the other room.
Mm-hmm. But the size that you have in the other room is the moderate. So these are, so there's 3 different cohesivities. The amount of stickiness to itself that the silicone has. For Mentor, there's something called memory gel, was the least cohesive, the most fluid. Memory gel extra, which is the same gel on the inside, but they fill it a little bit more, so it's a little bit more kind of plump.
Mm-hmm.
And then there's a memory gel boost, which is a different silicone on the inside that's a bit more cohesive. So for natural results, the memory gel boost is probably the most consistent with natural breast tissue. But these are, like, I could give you both of these implants and you hold them in your hand. Most people at a glance, they're not going to be able to tell the difference.
I couldn't. We did do that.
Yep.
Yeah.
In addition to these 3 cohesivities of implants, there's also 3 sizes with Mentor. And that's the moderate plus, which is most wide, least projected. There's the moderate high, which is a little bit more narrow, but a little bit further projected. And then there's the high profile, which is most projected in this direction, but the most narrow in this direction.
Okay.
So again, there's more than just a decision, a
Right.
size decision that goes into making the correct choice.
And you're choosing that based on what the patient's desired outcome is, right?
Right.
Or is it more of a just fitting it to their
No.
natural...
A little bit of both. So if she says, I really want a lot of upper pole fullness that I used to have when I was younger, the memory gel boost is probably the better choice of the 3.
Mm-hmm.
If she has a really broad chest like you might consider moderate plus or the moderate high profile, an implant that's going to cover that whole distance.
Mm-hmm.
If she says, I'm not so worried about upper pole fullness, I just want something that feels as close to a normal breast as possible, then potentially the memory gel extra is an option. There's a lot of overlap. It's very difficult to choose the wrong implant, but there's a lot of nuance in choosing the right implant.
So, in Savannah, were there any other surprises, both either positive or negative, that the things maybe you didn't expect would be the result of your augmentation?
Well, I think I was actually thinking about it as we were talking. I don't want to make it sound like it was all perfect and awesome. I did actually end up having a complication. Yes, I got an infection in one of the incisions. It just happens, I guess. I think, yeah. I tried to go around and round in my head as to what did I do? Was it my fault? But sometimes it just happens, and.
No, and that's a really good example. I'm glad you brought that up. So you had a superficial skin infection.
Mm-hmm.
A deeper infection in the implant capsule would have been a different thing to deal with. But for you, you had the option. You had the luxury of living with me, and I can tell you exactly what to do. But it's very important if you hit any kind of speed bump. If you why does this look like this? Why doesn't this look like this? Why can't I feel this? Why can't I feel this? Anything. It's super important that you have a direct communication with your doctor.
Mm-hmm.
It was as simple as giving you an oral antibiotic for 5 days, I think.
10, I think.
And then just giving you some topical treatment, and it
cleared up. Yeah.
And it went away. It's like it never happened.
Yeah.
So any cut obviously can get infected. That wasn't specific to surgery, right?
So despite the exhaustive effort there has been since the beginning of surgery to minimize surgical infections, we just cannot bring that surgical infection rate down to 0. But it's one of the great triumphs of medicine to bring it down to the typical. If you look at all of surgery, the overall infection rate is less than 5%. So we try to aim for 0, but it's literally impossible to get to 0. Unfortunately, you're gonna have people who come in, and despite all of the precautions that we take, you're gonna have a superficial skin infection sometimes. Mm-hmm. It's not the end of the world. In fact, it's just a little road bump.
Yeah, I would say that the worst part about it is that the scar is still a little more apparent than the other one. But it's under the fold, so you can't tell unless I'm like really looking for it. So it's, overall, because what you were talking about, if it had been infected in the capsule, that would have been.
You would have to take out the implant.
That would have been a nightmare.
We would have to take out the implant and then reattempt an implantation 3 months later. So you have to sit there with either one breast inflated, or we would take out the other one to make it match. Yeah. It's just, no one wants to go through that.
No.
So.
No.
And how did you feel after the implant settled in? How was did it change your confidence and how you feel about yourself
100%.
in a substantial way?
Yeah, 100%. I obviously care a lot about how my body looks. I exercise all the time, and and I had always felt like I would just be a little bit more balanced. I'm heavier on the bottom, and I'm like, man, what do I do here? So and after that, everything kind of fit better. I was able to, I wouldn't have worn this shirt that I'm wearing right now had I not had them done, because otherwise I would have had to put a push-up bra on and, just try to hike it up to my chin to make it look like I had anything. And, now I don't. So
is it something that you think of every day when you look at yourself in the mirror, or is it?
Because it's still relatively new. Mm-hmm. Yes.
What, 10 months out?
Yeah. Well, I got it in July.
Okay. So
it's still relatively new.
9 months?
Yeah.
9 months.
Yeah.
So at this point, it's all settled in and everything is
it's very happy with everything. Clothes fit better. I like wearing a bikini now. Before I wasn't. The bombshell, the Victoria's Secret bombshell was my best friend. I had the chicken cutlets to try to stuff everything and make it look like I had something. But now I don't have to.
Okay, so you're a lot more comfortable in less clothes, which is a goal many people have. Anything else that you can tell us about how internally perhaps your mental picture of yourself changed as a result of the augmentation?
I guess I hadn't thought about that. I feel a lot more confident. I feel much better about myself. It's, everyone always has those oh, what can I change? And now I feel okay, I'm very happy with everything. And that's not something that I've ever experienced. So I'm like, okay, we're here. This is great. And all I had to do was get a little boob job.
That's fantastic.
Yeah.
So, obviously a lot of, there's the outward appearance, but then there's the inner feeling of confidence that is often you don't see that in before and afters, you don't see that in anything. And so I'm always curious to see how something has changed somebody's, viewpoint of themselves in a positive way, obviously. And so that is a good outcome as well.
Yeah.
That's additional value that cosmetic procedures
Yeah.
provide, right?
Yeah.
What's your take on that? Is it? It's not all visual, right? It's everybody.
Oh, that's
gets
what we
a
do.
boost internally
as
too.
long as you don't when you perform these surgeries, you're performing them with the goal of satisfying your patient. Like, you don't want to tell the patient. You try to avoid the patient who comes in and says, well, my life will be better if I can do this because people will think more of me. What you want to hear them say is, I want this changed about myself, and I want your help with it.
Are there cases where you don't do a cosmetic procedure such as an augmentation because of the person's, let's just say, their psychological orientation in terms of that, what you were just talking about?
I haven't met a particular person that I've said, no, I can't do this for you, because I've been fortunate enough to, every person that I've had a conversation with, they've really understood. I've understood their goals, and they've understood my desire to make them satisfied from this procedure.
Mm-hmm.
But theoretically, yes, there is a particular person that I would have to say no to. Mm-hmm. People who just do not understand. I'm not going to be able to make them look like the photoshopped bikini person that they've come in comparing themselves to. People who say, "Oh, I'm not getting a promotion at my job because they're giving it to girls with bigger boobs." Like, well, then it's my fault if you don't get a job, if you don't get a promotion because your boobs aren't big enough. So there's a theoretical person that you want to avoid, but I'm lucky that I haven't come across that person yet. So
that is remarkable. What else? Any other conditions where somebody isn't a good candidate?
Yeah, you want to be in good overall health. Like I said, you want to have a reasonable expectation of what you're going to undergo, not only in terms of change with your body, but specifically what you're going to undergo on the day of surgery. You want to make sure you don't have any infections anywhere else in your body. You want to make sure you haven't had a bad interaction with any foreign material in your body previously. Make sure you don't have any chronic conditions that would prevent you from undergoing implantation of a silicone implant. You want to take with a grain of salt if you have autoimmune conditions, that those could be exacerbated. There's a little bit of data saying they could be exacerbated with placement of a silicone implant.
But this is something you go through with every person that comes in for a consult, which
Absolutely.
Right now I know that you're giving free consults.
Yeah.
Normally they're $350.
Yeah, so a lot
because this is our grand opening period. Now anybody can come in for a free consult to see what you can do to help them achieve their cosmetic goals, whether it be breast augmentation or something else that they might want.
A lot goes into a consult because some people come in requesting one thing, and then I sit there and I say, for example, if someone comes in and they have really tonic breasts, a lot of laxity in their skin, and their nipple is pointing downward, and they say, well, I want a breast aug. I say, well, a breast aug isn't going to give you what you're looking for.
Mm-hmm.
You would just have big, saggy breasts if you went through with just a breast aug. I have to tell them that really what you want is this other procedure. You could combine it with a breast aug. So a lot goes into a consult. I'd be happy to sit there and talk to anybody who comes in all day long about this stuff. It's my job. I love doing it. I could sit here and talk all day long about it. Normally we charge for consults. Just come in. Like we'll waive the fee. I'm brand new. I'd love to meet the people in the area and just kind of get things rolling with this new practice. So
that's fantastic. And then in terms of the cost of a breast augmentation, obviously it's going to vary by the area and the surgeon that does it.
Mm-hmm.
But right now, we're offering at Palm Beach Cosmetic Surgery breast augmentation starting at about $6,000, right? And we also have financing available that could be a payment as low as $162.
Yeah,
so
we try to remove that hindrance financially. So I want people to come and talk to me. So we try to make that price as low as we can. It definitely beats the price of other cosmetic surgeons in the area. That price includes a saline implant, and it's just a little bit more for a silicone implant if you want to go that route. And with it, and that's just the one price you pay, all of the follow-ups, all of the garments that you receive, you get my personal cell phone number during your recovery process.
Concierge service?
Yeah, concierge service. I'll drive to your house if you need me to.
Mhm.
But that's we try to make it as straightforward as possible. We have financing for you if you'd like it, and really it's just that price, and you get everything included.
And the level of care that you're able to provide is going to be different than a surgeon that's been operating in the area and has a treadmill of people coming through their offices, right?
The way I like to phrase it is, so I underwent specific fellowship training after 5 years of general surgery training, specific to cosmetic surgery. This is my baby. This is like my art, okay? And every person who comes through my door, my goal is to make them perfect, absolutely perfect, okay? So if something isn't going perfect, I want to know about it so that I can do whatever I can to make it perfect. Okay, when someone comes through the door and talks to me, I want them walking away saying, Dr. Sistare is the best ever. Yeah, I'm so glad I went to him. Not only is he a nice guy, but he smells good and he's good at surgery. You know, like that's what I want. So I want them to walk away thinking that they're perfect, and I want them to be as satisfied as possible.
Well, that's a very attractive situation versus a surgeon that doesn't see you during the consult and
I can't imagine.
Basically, just does the surgeries. I know that there are some surgeons that do quite a few in one day.
Yep.
They have videos of them doing 20-minute breast augmentations or something like that, right? Savannah, thank you so much for coming on. Obviously, we protect our patients' privacy, and a lot of patients don't want to talk about the work that they've had done. And we really appreciate your being open to talking about it. And is there anything else you wanted to talk about regarding your...
I don't think
the high
so.
points?
The high points?
Mhm.
Well, they were about here. No, I'm just kidding. No, I mean, just overall, very happy with it. A lot more, mild despite the complication. Mild recovery. 10 out of 10 would do it again.
Nice.
Probably will after kids.
So if somebody said to you, I'm thinking about a breast augmentation, I heard you had it, you would tell them...
Do it.
You would tell
Just
them to do it and
do
it, and you'd obviously advise them on how to go about getting the best outcome in terms of expectations and stuff like that.
Yeah, I mean, just go see Dr. Sistare.
Well, I think that you're in a unique position to provide the best care to patients.
Mm-hmm.
It's a lot different. Hopefully that won't change when you get a lot busier.
Oh, I don't plan on it changing.
Because with your skills, I'm sure you're going to have a lot of people coming to see you here.
Mm-hmm.
So thanks very much for everybody for coming in. If you don't have anything else, I guess we'll close it there. Again, I'm Andrew Peterson here with Dr. Michael Sistare and Savannah. We'll have another episode for you soon. And thank you so much for joining us and listening in.
Thank you.
Thank you.